Nurses generally, we see firsthand what their patients are suffering. A little bit different to the doctor's perspective, I feel, and I've always felt that, with the utmost respect to the medical profession.
I guess nurses are with their patients 8 to 12 hours every single day. So we see a lot more of their suffering. We answer the call bells when they're in pain and they're uncomfortable. They tell us how they're feeling, and they'll most of the time just sort of tell us and want us to sort of relay that to doctors.
The best counselling that I have ever done is usually leaning up against the corridor wall outside the patient's room. So you're talking to family members who sometimes feel that they can ask you questions that they don't feel comfortable asking the doctors.
So we've built up usually a rapport with the family or the doctors or the patient, and sometimes we know that things could have been done differently or better, and that can cause emotional distress for us.
I mean, to watch someone struggling to take every single breath is really quite distressing for us, as nurses, and we see it quite a bit. So to have to see their family go through that as well, and their loved ones and them suffering like that is pretty awful.
And it's very hard when somebody comes to you and says, it's not fair, this is so distressing, I can't bear to see him or her like this. It breaks your heart.
Pain relief medication doesn't help everybody. It's a small number that really don't get the relief at the end of their life, but it's profoundly, it's something that you profoundly remember when you see that.
I've had people ask me many times whether they're at the end of life or not, and they'll have expressions like, "Can you just bop me on the head? I've had enough." And I have to say, no, I can't.
They just beg you. They clutch at your hands. They pull you towards them and just say, please, and look you in the eye and say, I don't believe you can't do anything. I know you can. I know you've got the power to do something to help me. Please help me.
And it's not always about pain. It's about people suffering. It's the loss of dignity people feel. It's the loss of control that they feel as well.
It was just so sad to see people suffer this way. And for me, it just seems so unnecessary. Palliative care in Australia is a wonderful thing. We have some of the best palliative care options and services in the world, in this country.
What we would like to see is that if palliation fails, that there is another option. And I think a lot of nurses feel that voluntary euthanasia should be an option open to those people who feel that their condition is completely hopeless, and that's what they've been told by their doctors, and that their suffering is incredibly unbearable.
It's simply an adjunct to the skill set, if you like, and it would sit well with palliative care, an option to assist somebody's death when there's nothing more left to be gained from palliative care.
I think people have the right to choose how to die with dignity or when to die with dignity, because a lot of the dying that we see is not with dignity. It's not in peace. It's not comfortable. And it's not fair.
I don't see why a person shouldn't determine that they wish to die when they can still say goodbye to their family, as opposed to laying in a bed unconscious, heaving with breathlessness, and the family having to witness that and the person eventually dies. I'd rather they had a better experience than that.